Let's talk about bowel malignancies or bowel cancer. Most of these are preventable. If people have regular colonoscopies and screening, these can be ruled out and caught because it takes a polyp a long time to become cancerous. So by doing the preventive care, by getting it checked up, many people could avoid actually contracting it in the first place. So what happens if they do find a malignancy? How is that going to affect the surgery? You're not going to want to handle the malignancy a whole lot because you don't want to seed the part of the bowel that has the malignancy. You don't want to seed any of that cancer by manipulating it too much. The other thing they're going to do is they're going to make sure that they take margins on either side of the bowel to make sure that they are beyond the cancer and they get it all out. And they're going to have the lab check the margins to make sure that they're clean, that there's no cancer in them. If there were any cancer, they'd come back and they would take out more of the bowel from where they found the margins weren't clean. And then the other thing they're going to do is they're going to take some of the nodes in the mesentery that feed that part of the bowel, because they're going to look at those nodes and see if any cancer has metastasized to that part of the node. And depending on what they find with that, then they're going to have to use different treatments post-operatively and possibly might require more surgery. A couple of the identification aids when you have the gastroenterologist or the surgeon who's done it preoperatively, done the colonoscopy, that they're going to try and help pinpoint where it is, because when you get in and you're looking at the outside of the bowel, you may not always know what's going on the inside. So you're going to have the gastroenterologist report that's going to tell you them how far it is and what part of the bowel it is. And then you're going to have the scope that they may check during surgery. But beforehand they would have done a colonoscopy. And then while they're doing the colonoscopy preoperatively, sometimes they will actually tattoo the area so that when you go in to do the bowel surgery, it's either the green or the blue that they marked it with, and you can see what part of the bowel is affected. And sometimes you can see it easier than others. And once in a while, it's penetrated the bowel walls and it may have sprayed a little bit around. So you just have to be diligent in looking for where that tattoo is.